There is remarkable new evidence tonight that stem cells can repair a damaged heart, and the early going suggests it is a powerful effect. The findings were presented at a meeting of the American Heart Association today, but we've been following this therapy for 2 years. It's important to note that it's just the beginning of trials, and it's not clear where all of this will lead or how many patients it might help. But we asked Bill Whitaker to show us what's happened to the very first patient who received this treatment.
So Ken, how are you feeling?
I feel fantastic.
When we first met Ken Millis 2 years ago, he had suffered a serious heart attack.
The artery that was 98% blocked, that particular type of blockage is called the widowmaker, because it's the one where typically when people get it, it's over, they're dead.
At age 39, with 30% of his heart damaged, he faced a diminished life of limited exertion and shortness of breath. So he volunteered to be patient number 1 in a risky clinical study, the first person ever to receive an infusion of heart stem cells. The experiment was the brainchild of Dr. Eduardo Marban of Cedars-Sinai Heart Institute in Los Angeles.
If someone's had a heart attack and they have seen part of their heart turn into scar, that is irreversible. It's there for life.
Seeking to reverse heart injury, Dr. Marban used a catheter with tiny pincers to snip bits of healthy tissue from Millis's heart. Since the heart produces so few stem cells on its own, Dr. Marban, in a laboratory, coaxed the bits of tissue into producing stem cells, millions of them. He then deposited Millis's own laboratory-grown stem cells into the damaged area of his heart, hoping it would repair itself and beat more strongly. Previous studies have used bone marrow stem cells with mostly disappointing results, prompting Dr. Marban to try this new approach.
Now we've completed the study, and we have outstanding results that are very encouraging to us.
Millis was one of 25 volunteers in this small study. 17 got stem cells, 8 control subjects got standard heart care. All the stem cell recipients had their heart attack scars reduced, most dramatically. On average, almost 50%. Damaged muscle replaced by new healthy heart tissue. The 8 control subjects saw no improvement. Ken Millis had better than 50% improvement.
People have been talking about stem cells and their regenerative potential for a long time, but most of it really has been wishful thinking. This is where the rubber actually hits the road.
No shortness of breath, no pain, no anything?
Never.
Doctors say his heart looks almost normal again. And Ken Millis says he feels so normal, he never even thinks about his heart.
It's like someone gave me a magic pill. I felt better all over, suddenly. You know, it's science fiction, basically, to me. That's what it feels like.
Now, these are the first results of a unique study. Now, other researchers will have to try to replicate this, which could take 2 to 3 more years. But Scott, these first results seem promising.
Thanks, Bill. Especially promising when you consider there are 935,000 heart attacks in America each year, and a third of those, 325,000, are repeat heart attacks.